Paul Kelly, thanks for joining us again. I've got to ask you about borders. I just don't understand why we have 4 Australian states with their interstate borders closed.
Yeah, I've been asked a lot about that today, Chris, and obviously the states and territories that are responsible for those decisions in the first place are examining all of that right now in this new situation of very few cases. We've got about 650 cases in Australia right now of active disease, so out of the over 7,000, that's what's left, and about 45 of those are in hospital, and most of the rest are in quarantine, either because they've come back from overseas or because they've been found as a case and have been asked to stay at home. So they're not going anywhere. Of course, we are still finding people in the community, and the states and territories themselves will have to make that decision about when they feel safe to open their borders, to open the potential for that to come into their own state.
At the start of this pandemic, we were told about suppressing it, keeping infection rates low enough to manage, protecting the capacity in our health system. We've built that up, of course. But now some of the state premiers are sounding like they're running an elimination strategy. Stephen Marshall, the Premier of South Australia, says he won't open his borders until there are no new infections happening in the other states. Well, that means his borders could be closed a very long time, doesn't it?
They could be, because the states where the infections are still are indeed going along that suppression line, and that is the nationally agreed line. Of course, states and territories have their own governments. They can make their own decisions, but that could be quite a long time before we have no cases. We're looking to minimise the cases and keep within our capacity and to protect our more vulnerable groups. That's been the way we've handled this virus up to now, and it's been very successful using that approach.
Well, not only has it been successful, but you and your colleagues have been very clear about communicating that strategy, that you'll expect more infections, but you want to isolate them, trace them and suppress them individually, and that's what's been happening all along. Under that scenario, you would expect, wouldn't you, until there's a vaccine, that we're going to have infections in this country? It could be a year, it could be 5 years.
And we have to continue to consider the possibility that there will never be a vaccine. That's still, one of the options. We hope very much that that's not the case, and there are a number of very bright minds, large companies, and a lot of money from philanthropy and from governments all around the world working on finding a vaccine, with lots of candidates that are being now tested. But we've never had a vaccine against coronavirus before, any type of coronavirus. And so we have to think about that possibility. And for the state borders, it may be quite a long time if they are to stay so close to this idea of having no risk at all.
Well, of course, you're not in the business of advising the state governments. You advise the federal government. But on medical grounds, wouldn't you suggest that our country, behind our quarantined international borders, has to learn to open up and live with this disease within our national borders?
Well, you make a very good point there, Chris, about the international borders. I still think that's the number one thing that we did at the right time, starting on the 1st of February when we started to limit our borders in relation to China, and then over time to the whole world, really. And so now we're seeing a very small number of people coming in, and they're all going into 14 days quarantine. They're all being monitored closely, and that's still the majority of the 7,000 cases we've had in Australia have been related to international travel, either directly or having been in contact with someone who's come back in those early days. So we've got that border very, very much locked down for the time being. We've got our quarantining, our case finding, our laboratory capacity, all of that's really built up. We're starting to lift those social isolation measures throughout the country in slightly different ways and in slightly different speeds in different states. So we're moving into that next phase, and I really do hope that next phase includes the opportunity to go and visit my family in Perth and my family in Sydney and friends in other parts of the country, and indeed get back to the normal way we do business around Australia. So with those those border closures, that does make that difficult.
Yeah, I'm with you. I'd like to get to see my parents in South Australia as well. Just a couple of issues I want to get some clarity from you on, Paul. You've been clear in your advice all along about the fact that schools, the medical evidence was schools should not have been abandoned, if you like. Classrooms shouldn't have been emptied. They're starting to go back now. All classes back in New South Wales from Monday, 5 days a week. Victoria and Queensland somewhat behind that. But there have been a couple of infections in the news today involving teenage school students. We're going to get this, aren't we? This doesn't mean that it's wrong to reopen schools.
No, opening schools is absolutely the right decision, and I'm really glad to see that happening in almost all jurisdictions. In fact, it's happening to a certain extent in all jurisdictions, and many of the states and territories have gone back to full schooling, and in some cases that's the only thing that's being offered. No more online remote teaching. So that's all very positive. It's the best way for kids to learn. It's safe from a medical point of view at this stage in the epidemic. But I think we need to be really clear that as we do open things up, we do expect to see cases in schools associated with other ways that we're opening society and the economy, and that's a success, not a failure of this particular stage in the epidemic. As long as we find them quickly, we get them diagnosed and treated if necessary, isolated at home. That's the way we keep on top of the epidemic. We're not going to get to zero in the early phase, but limiting the numbers is really important. And in terms of schools, yes, we do expect to see that in schools, and I understand that particular school, my son's old school actually, in Sydney, has taken the right action, and it will be closed for a short period whilst they get on top of that outbreak.
And just quickly, finally, we've talked before about hydroxychloroquine. There's clinical trials underway in Australia to see whether that can actually help prevent people getting the coronavirus infection. On that basis, and given we know a lot of doctors are actually prescribing it for coronavirus around the world, it's not particularly surprising that Donald Trump would give it a go.
Oh, well, there is never surprises there in that particular famous house in Washington. But look, hydroxychloroquine has shown some hope that it might be of assistance for either treating or preventing this particular disease, but it's only a hope at the moment, and the appropriate way to look at hopes is to do a proper clinical trial. And so we've funded a trial based out of Melbourne, out of the WEHI, the Walter and Eliza Hall Institute. Some of our best scientists are involved with that particular trial, and so they'll be looking to see if that assists for healthcare workers going about their profession. There's another trial, I believe, in the military based in Queensland. So we'll look with great interest to see what the results of those trials are. But this is not the time to be experimenting on oneself or to be taking unproven medicine. There are ways of avoiding this virus with good hygiene, hand washing, cleanliness, social distancing, keeping that 1.5 metres away, and listening to the other public health advice that comes through.
And that's the stuff we've got to keep doing forever and a day after we open those borders. Thanks very much, Paul Kelly, for joining us.
You're welcome, Chris.